Quist, Public Health Division Communication Officer with Oregon Health Authority. Today we are talking about respiratory viruses and all the things Oregonians need to know to stay safe and keep their children safe as well. And joining us today is Dr. Melissa Sutton, Medical Director for Respiratory Viral Pathogens with Oregon Health Authority, Dr. Sarah Leosa from the Harney and Malheur County Health Departments, and Dr. Richard Bruno from Multnomah County Health Department. And this is a friendly reminder for our media colleagues to use the raise your hand function when you have a question you'd like to ask, and I'll add you to the queue and call on you to ask your question. If you'd like a recording of today's briefing, the link for the YouTube live stream will become the link for this recording when this media briefing is complete. Okay, let's get things started. Dr. Sutton.
Good morning, everyone. My name is Dr. Melissa Sutton, and I serve as the Medical Director for Respiratory Viral Pathogens at Oregon Health Authority. As Eric has said, I'm joined today by two colleagues, Dr. Richard Bruno from the Multnomah County Health Department and Dr. Sarah Leosa from the Harney and Malheur County Health Departments. We're here today to talk to you about the upcoming respiratory virus season and the Department of Health and Human Services' new Risk Less, Do More Fall Respiratory Virus campaign. This campaign aims to limit the spread of respiratory viruses by informing people about what they can do to protect themselves this respiratory season. As cooler weather heads our way and people begin to gather more indoors, we know that respiratory viruses such as COVID-19, influenza, and respiratory syncytial virus, or RSV, may increase. Fortunately, we have some very effective tools to help people risk less and do more this respiratory season. For COVID-19 and influenza, we have updated seasonal vaccines, which are recommended for all people 6 months of age and older. For RSV, we have immunizations which help protect two different populations, infants and the elderly. For infants, we have two options for protection, and only one of these, not both, is needed to help protect them. First, a maternal vaccine for pregnant women, and second, a monoclonal antibody called nirsevimab for all infants and some high-risk young children. To help protect older adults from RSV, we have an RSV vaccine that's recommended for people 60 years and older with underlying medical conditions and all adults 75 years and older. Every respiratory season, we see a dramatic increase in the number of hospitalizations and deaths caused by respiratory viruses, and we cannot always predict who will become severely ill. RSV is the most common cause of hospitalizations among infants in the United States, with up to 3% of infants under 6 months of age hospitalized each year. Most of these infants have no underlying medical conditions. Similarly, about half of children hospitalized with COVID-19 have no underlying medical conditions. These immunizations act as our best defense against severe disease, which can affect anyone. Last season, the CDC released respiratory virus guidance, which provides practical information on how to reduce the risk of respiratory viruses. This guidance highlights the importance of core and additional prevention strategies people can take when local respiratory virus transmission is high. Core strategies include vaccines, as well as hand hygiene and cough etiquette, improving ventilation, and staying home when sick. Additional strategies include masking, avoiding crowded indoor gatherings, and testing when sick. People in Oregon can monitor local respiratory virus transmission on Oregon's respiratory virus dashboard. The Risk Less, Do More campaign offers healthcare providers a range of resources to share with patients, including patient handouts, digital banners for websites, and social media messages. We call on all providers to order and offer these vaccines to all eligible patients at each visit. And we call on all healthcare providers to familiarize themselves with indications for COVID-19 and influenza antiviral treatments, which, like vaccines, reduce the risk of severe illness. And now I will turn it over to my colleague, Dr. Richard Bruno, to talk about Oregon's measles and pertussis outbreaks.
Thank you so much, Dr. Sutton. Good morning, everyone. My name is Dr. Richard Bruno. I serve as the Multnomah County Health Department's health officer. And as Dr. Sutton mentioned, Oregon currently has outbreaks. We have both measles and pertussis outbreaks right now. So far, there have been 31 cases of measles reported this year, which is the highest number we've had in Oregon since 1991. All of these cases have been in unvaccinated people, and unfortunately, 2 of those have needed hospitalization. The good news is that the most recent measles case was confirmed mid-August, so we may be nearing the end of this outbreak. The not so good news is that school children in Oregon are below the 95% vaccination rate that's needed for herd immunity. So now that kids are back in school, we may see some additional measles cases. I also wanted to let you know there's another outbreak we're tracking that's for pertussis. Pertussis is also known as whooping cough. And there are 560 cases of pertussis in Oregon this year, which is much higher than previous years. Pertussis usually begins mild cold-like symptoms that can be missed at first, usually progresses into an uncontrollable coughing that can have that characteristic whoop sound. And babies in particular are at high risk for complications and can struggle to breathe. And unlike the other illnesses we're talking about today, pertussis is a bacteria, not a virus. So it's important to see your healthcare provider if you have a cough that's not getting better or if you think you might have pertussis. Your provider can prescribe antibiotics if they suspect pertussis or confirm a positive test, which will hopefully help you get feeling better and moving quickly back to school or work. Now, measles and pertussis are 2 of the most contagious diseases in the world, but they also have very effective vaccines. So for measles, it's a good idea to find out whether you're immune or not. You are immune to measles if you have received two doses of the vaccine, if you were born before 1957, or if you've been diagnosed with measles in the past. And if you're not sure, it's never too late to get your measles vaccination. For pertussis, most people get vaccinated when they're children. The last dose is usually at age 12, and most people get updated every 10 years as part of the tetanus booster. Like some other vaccines, protection can wane over time, so you might get sick even if you are vaccinated, but your symptoms will probably be less severe. And like COVID and flu and RSV, measles and pertussis spread when somebody who is sick coughs or sneezes. But fortunately, we have vaccines for all of these illnesses to help protect us. So please consider making sure you are up to date on all of your COVID, flu, RSV, measles, and pertussis. And now I'll turn it over to my colleague, Dr. Sarah Leosa.
Thank you, Dr. Bruno. Good morning. My name is Dr. Sarah Leosa, and I serve as the Harney and Malheur County Health Officer. The Risk Less, Do More campaign highlights vaccines as among the most powerful tools we have to protect ourselves and our loved ones from respiratory viruses like COVID-19, influenza, and RSV. These vaccines are safe, effective at preventing severe disease, and widely available. Best of all, they can be co-administered, meaning given at the same visit, reducing the number of visits people need to make to their local pharmacy, clinic, or health department. As a physician, I care for patients with these infections in the community, as well as patients who require hospitalization. And I know that many people in Oregon have questions about vaccines. Unfortunately, there is an incredible amount of disinformation on vaccines in the world today, and it's important that people seek information from a healthcare provider they trust before deciding what is best for them. I want to encourage everyone out there to ask your healthcare provider any questions you might have. They want to hear from you, and they want to inform you and empower you during this respiratory season. Today, I also want to remind Oregonians at increased risk of severe COVID-19 infection and influenza to talk to their healthcare provider about what to do if they get sick. People at increased risk for severe COVID-19 infection include the elderly, pregnant women, and all people with underlying medical conditions. People at increased risk for severe influenza infection include all of those same groups, as well as children under 5. There are safe and effective antiviral treatments available for both of these diseases, and they work best when given early in the course of the illness. Talk to your provider about how you can get tested and treated if you are sick. Lastly, I want to talk about how the respiratory season affects our hospitals in Oregon. Compared to other states, we have among the lowest hospital beds per person in the nation. That means that any increase in respiratory diseases can quickly fill our emergency rooms and hospitals, slowing care for all and putting incredible pressure on our dedicated frontline health workers. We also live in a beautiful and rugged state with large rural and frontier counties. In these rural areas, access to care can include additional challenges, such as extreme weather events, prolonged road closures, long distances to the nearest healthcare provider, and limited emergency medical resources. In these under-resourced areas, preventing severe illness through vaccines and early treatment is essential. Thank you for your attention today. We're now happy to take any questions.
Thank you again to our experts. I have not seen a single raised hand, but we are here. Oh, there we go. They're coming in. All right. Our first media inquiry comes from Amelia Templeton with OPP. Go ahead, Amelia.
Council to decide.
Okay, thank you very much. Sarah, I wanted to ask if that last point, if that's something that you see in the counties that you serve in Malheur and Harney County, and if you're making kind of a direct appeal to Oregon's rural residents to get vaccinated.
Absolutely. I think it's important for rural residents to get vaccinated. In Harney County, which is where I live, it can be 3 hours in a single direction to get to medical care. And I think it's really important to do the things that we can do to prevent the severe disease so that they don't need to access that medical care that can be so hard to get to.
Thank you.
Thank you, Amelia. Our next question comes from Jake Thomas with the Lund Report. Go ahead, Jake.
Hi, I'm wondering if OHA or anyone else has done any kind of modeling to kind of predict or just have an idea of what hospital capacity might look like as we go into this season.
Hi, Jake. I'm happy to take that one, team. It's a really good question. So we do work closely with our hospital partners statewide to monitor capacity. But I think what you're really asking is, are we able to forecast how severe this respiratory season will be? Because that, of course, will determine the hospital capacity issues. For COVID-19, I think because it's still very much an emerging pathogen, the CDC is able to produce short-term forecasts, so 4 to 6 weeks out. That doesn't provide us a lot of insight into a respiratory season, and they actually place that forecasting on hold over the summer because they are trying to improve those models. So they should be back in October. For influenza, we often look at information from the Southern Hemisphere to help us understand what our season might be like in the Northern Hemisphere. This year, we have a really unclear picture from the Southern Hemisphere. We have a handful of countries who had quite severe influenza seasons. And then we have some countries that had really mild seasons. So we really don't have a clear picture of what we're facing this year. And I think that's why it's always important every single season to get that updated seasonal vaccine for both of those pathogens.
Thank you for that question, Jake. We have a second question from Amelia Templeton. Go ahead, Amelia.
Thanks. I have a couple of questions about the numbers that you shared. You said up to 3% of kids' hospitalizations are for RSV. I just wanted to make sure I was getting that statistic correct, and also to know what the source is for that. And then I wondered if you could offer, you had mentioned that half of kids hospitalized with COVID-19 have no underlying conditions. Can you also provide some context for how common or rare hospitalization is for COVID-related hospitalization.
Yeah, sure, Amelia. Thanks for those questions. For the first question, the statistic I cited was that in any given year, up to 3% of infants under the age of 6 months are hospitalized with RSV. And that statistic is for here in the United States, and it comes from the CDC. So it's really an impressive burden of disease, of severe disease. And then the context for COVID hospitalizations. So I don't have the numbers in my head offhand, but I can tell you that for COVID-19, we see our highest hospitalization rates in adults 65 years and older. And then actually our second highest rates are in infants under 6 months of age. And I think that that's a fact that isn't well publicized, and really we need to share more broadly. And we are going to be aiming to do that this season. And I know the CDC is aiming to do that as well. So in terms of how common or rare it is in general, you know, the risk in children decreases as children get older. So it's that under 6 months that's really at quite impressive risk. And then, you know, as those kids get older, it becomes, I would say, quite unusual, right? When we're talking about adolescents, we don't see a lot of those hospitalizations, but they do occur, and they can occur in anyone.
Thank you for those questions. And we have a follow-up from the Lund report. Go ahead, Jake.
Thanks. I just had a follow-up. So would it be fair to say we don't, just as far as forecasting, there's not a super clear picture about just what this season might look like? And also I was wondering if there was like, if there's a county or maybe an area of the state or maybe elsewhere that kind of serves as the bellwether to kind of get a sense of how the season is shaping up.
Good questions, Jake. Are you specifically asking about COVID-19 or influenza?
Kind of all of them, all three, the COVID, RSV, and influenza.
Okay. So for COVID-19, so we don't have a clear seasonal pattern established for the pathogen. But if you look back at the last, almost 5 years of data, you will see that we've started to get into a summer surge and a fall-winter surge. Now, exactly when those surges start and stop has varied pretty dramatically, as well as the intensity of those surges. So I would feel confident in saying that I do expect a fall-winter surge. But right now we're in a late summer surge, and we're sort of coming out of that. So I think we'll likely not see that until later into the winter. In terms of a bellwether for COVID-19, we really see pretty consistent COVID-19 activity statewide. When we do see hotspots, we think it has to do with a lot of travelers coming in and out of the area. So places like Portland or Bend, or maybe Ashland, during a Shakespeare festival. Whenever you have a lot of travelers coming in and out, you can have additional introductions of an infectious disease. For influenza, I am looking forward to seeing the fall forecasts. I do think we have a lot more historical information about influenza. So I do think those models tend to perform a little bit better. I don't believe they've been released for the upcoming season yet, but we'll be watching for them. And then in terms of the bellwether, it is true that we'll often see influenza enter into one region of Oregon first. Sometimes that's Southern Oregon, sometimes it's the Gorge, sometimes it's Portland. But generally, when we see it enter a region, we know it's coming for all the other regions very quickly. Again, we don't see huge differences in activity throughout the season by region. And then lastly, for RSV, I don't believe there's any forecasting available from CDC. Part of that is because we have only been performing RSV surveillance for a handful of years. So it wasn't one of the big pathogens that, we followed over time. That was really just influenza. And it was after it was recognized that RSV was causing severe illness, not only in babies, but also in the elderly, that we began to pay a lot more attention to it. So there's really limited information there to inform those models. And in terms of a bellwether for RSV, again, once we see activity increase, it tends to spread quite quickly.
Thank you for those responses and those really thoughtful questions, Jake. Alexander, I see you, but we have another quick follow-up from Amelia. And Amelia, thank you for muting after asking your question. We appreciate that. Go ahead.
Yeah, I have a question about access to all of these vaccines, particularly the RSV vaccine for people who are pregnant. What can you tell us about if it's currently available, if if it's getting into people's arms, and whether the large health systems, Kaiser, Legacy, OHSU, Providence, are actually administering it currently?
Thanks, Amelia. Really good question. So I read up on vaccine access, and what I learned is that for all ACIP recommended vaccines, patients on Medicaid should have coverage. All health insurance marketplace plans and most private insurers must cover those recommended vaccines without charging co-insurance, but in some instances, cost sharing should apply. So really the best recommendation is to go to your insurance company if you have one and ask those questions directly. In terms of whether or not the maternal RSV vaccine is available now, so it is recommended for pregnant women between 32 and 36 weeks of pregnancy during the RSV season. And so they've sort of delineated that between October and March. So it's not going into arms quite yet, but it should be within the next few weeks. We do know that there were a lot of providers who weren't able to carry the vaccine last season. There were a lot of concerns about reimbursement because it was the first season that the vaccine was offered. And the insurers have a season to begin to provide coverage. So we do think that the insurance coverage question will be less of an issue this season, and hopefully we will see more maternal RSV vaccine out in the community.
Okay, our next question comes from Alexander Banks with the Baker City Herald. Go ahead.
Hi, yes. I had a question for Dr. Richard Bruno. So you spoke about the 31 cases of measles and the 560 cases of pertussis that have been reported in Oregon, but I just wanted to ask, is there a specific city or county where most of these cases were being reported?
Thanks for the question. So for the measles cases, they have been mostly congregated within Marion County and Clackamas County. We did have one case that we don't think was linked to those other cases in Multnomah County. For the pertussis, that is more statewide numbers, and I don't know if there's like a place where it's congregating. I think it's been pretty broad across the state, but Melissa may be able to give more insight there. Dr. Sutton?
Thanks, Dr. Bruno. I also believe it's statewide, but we can take a look at those data and get back to you if we find that it is clustering in any particular region of Oregon.
Thank you for that question. Our next question comes from Ben Botkin with the Oregon Capital Chronicle. Go ahead, Ben.
Thanks. So this question was for Dr. Bruno. I just wanted to double check and make sure that the numbers you gave for measles, that those were statewide and not just for Multnomah County. Thanks.
Yes, thanks for clarifying. Yeah, one of the 31 was Multnomah County based, and the others are mostly Clackamas and Marion County. We've been talking very closely with those counties, with their health officers there, with their communicable diseases and infectious diseases teams, as well as our state support at OHA to address the outbreak of measles in those areas. But yeah, thanks for asking the question.
And I see there are still quite a few media partners and our media colleagues on the line. If any of you have any further inquiries, go ahead and ping me. Give it just a moment here if there's any other follow-up questions. Oh, Amelia, go ahead.
Sorry, I got a bunch of follow-ups. I don't want to keep other people.
No, you're good.
On the COVID vaccine for children, that's a place where I think a lot of parents are sort of on the bubble in terms of feeling like whether or not it's worth it for their particular kid. Most people have had COVID. Lots of people have had it multiple times. So I think it's fair to assume they have some degree of immunity from that. A lot of people have been infected and vaccinated. And I guess I'm wondering, based on what you said about the really high risk being for the very youngest children, whether something families should be considering is if they have any of, if you have a kid under one and an older kid, if that might be a more compelling reason to get your older kid vaccinated, if somebody is on the fence.
Thanks, Amelia. I always enjoy your questions. I think it is a compelling reason for many people, right? So the recommendation from ACIP is for the general population, 6 months and older. But I think the risk less, do more campaign is about questions like this, right? It's about every person understanding their risk and the risk for their children and their loved ones around them, and then making individualized decisions. Where there are babies under 6 months of age, we absolutely strongly recommend either that mom is vaccinated, that mom is vaccinated during pregnancy, and also that family members who are going to be in contact with that infant are vaccinated as well.
Was that it, Amelia? You've got our experts here to answer all the questions.
I can throw one more out there, which is just the access question, but for the COVID shot as well. Do you know when the new, I heard somewhere it might be sort of this weekend that it's actually available and people are able to schedule vaccination. But yeah, anything you can share about to people who want to get the shot and are eager, what do we know about access to it and when it will actually be here in the state?
Great question, Amelia. It is actually available now in some places, and over the coming weeks, we expect that availability to grow pretty significantly. So I would say to people who are interested in getting it now, call those places that you would normally call for your vaccine. Your clinic might have it, your pharmacy might have it.
As well as health departments as well. Make sure that folks, especially if folks do not have insurance, there are ways to get access for children and for adults through health departments.
Thank you for that question. We had an inquiry from Heather Roberts. Heather, go ahead. You may have lowered your hand. I saw it come up. Okay, well, it looks like we're at 30 minutes and we've answered all of the questions that have come up. Everybody who was added to the queue has asked their questions and follow-up questions. So thank you very much. Very thoughtful questions. And that will wrap up today's media availability. We'll be sending out a news release after this media availability around 1 o'clock today. So watch for that. There will be talking points and links. And again, as I mentioned earlier, if you'd like to view this video or recording of this actual briefing that we're participating in right now, it will be on the link for the YouTube live stream. It'll replace the link for this recording when this briefing is complete. Hopefully that makes sense. As always, you can contact our OHA Public Health Division email. Many of you have it, all of you I hope have it. And I want to thank all of our experts today for their time. And thank you all for being here today. Have a wonderful day, everyone. Thanks so much.